Hello, it's Dr. Rhonda Johnson. Today's Friday, January 7th, 2022, and today I'm going to be talking about caring for your medical conditions even during this time of COVID. Now, we know we've all been focused on COVID for the past 2 years, and we've all gone through a lot. The impact of COVID is great, and it's felt in so many parts of our lives. But today I'm going to be speaking on medical conditions, both acute and chronic. So folks, let's start. If you have diabetes, COPD, hypertension, asthma, heart disease, depression, cancer, or whatever health condition that you have, you know these conditions aren't going away just because of the pandemic. But yet, people with chronic medical conditions are deferring their visits with their healthcare providers, and people are deferring screenings such as mammograms and colonoscopies, which can lead to early detection of cancer and treatment for that cancer and improve survival. Other folks are deferring preventive care such as well baby exams and well child shots and dental checkups and eye exams, sometimes out of fear that they may catch COVID at their doctor's offices. Well, let me reassure you folks, you're far more likely to catch COVID in the community setting than at any doctor's office. Now, many healthcare providers offer video or virtual visits. Please take advantage of them. And, don't forget the oral health and our mental health care that's needed. And we have to continue to practice healthy behaviors, even though we are coping with pandemic realities. Health surveys show that people are exercising less, eating more, and consuming more alcohol. And I know we don't often talk about sexually transmitted infections, but folks, the rates of syphilis, chlamydia, and gonorrhea have hit record highs here in the United States. So, folks, we need to have a New Year's resolution. I'm asking that you add one to see a healthcare provider. You can start with your PCP or your behavioral health or your medical care specialist if you're followed for chronic conditions. We know that lack of movement, poor nutrition, tobacco use, and excessive alcohol use are responsible for many chronic diseases. And if we just address these behaviors, it'll help prevent a lot of complications and reduce the risk of cancer. And folks, please get tested for STIs if you're at risk, and please modify your high-risk behaviors. So in closing, COVID is not the only health condition we have to concern ourselves about. Thank you for listening. As always, my views are my own. Be safe, folks.